Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am your co host, Jocelyn Turner. It is so hot here in Northeast Florida. Oh my goodness, it almost seems like it's the heart of the summer. But I heard, Dr. Kane, that it's going to be in the 60s next week. So here we are in Florida. We experience different seasons either the same day or within the same week. So, how are you doing this evening before we bring in our guests?
I'm doing absolutely fine. Bring on next week, tomorrow.
You having hot flashes, Dr. Kane?
Yeah. What can I tell you? I got to go and get me some hormonal therapy. What can I say?
Well, I am super excited. We have two of my favorite folks on the podcast tonight as we talk about Stronger Together, how community partnerships improve mental health and well-being. So I am going to start ladies first and bring in our guest, Dr. Vicki Wadowich. How are you doing this evening, Vicki?
I am doing fantastic. Thank you both for having me.
Oh, absolutely. And I know our audience wants to learn more about you and hear what the great work you're doing here in Jacksonville. And of course, I almost say one of my favorite physicians, but Dr. Kane might have gotten jealous, Dr. Goldhagen. So I'll just say one of my favorite physicians instead of saying my favorite. But how you doing this evening, Dr. Jeff Goldhagen?
Really well, very well. Thanks. And thanks for having us. And thanks for all you folks do. This is amazing how long you've been on consecutive weeks. I mean, it's really a great contribution to the community.
You know, she wanted to call you Jeffrey.
Yeah, yeah, I kind of did because that's my brother's name. So
Jeff,
but
please.
yes,
Please.
yes. So tonight's topic is very important. Across the country and right here in our own communities, we are seeing rising levels of stress, trauma, anxiety, depression, and substance use challenges. These issues affect children, families, and adults in every neighborhood and every profession. But one thing is very clear: no single organization can solve these challenges alone. Improving mental health requires collaboration. It requires healthcare providers, community organizations, schools, faith leaders, public health agencies, and residents working together to build stronger systems of support. That's why I was excited to see on the news a few minutes ago where the Duval County Public School had Social Worker Appreciation Day. And I thought, what a great thing, because social workers are the ones who are interfacing with these young people on a daily basis. So to really recognize them and the work they're doing. But what I also like, Vicki, I think this is something I was talking with someone else earlier about it today. You can't continue to be helpful to others if you don't first take care of yourselves. And that was the focus of their event today with the social workers, really showing them some love and encouraging them to focus on their own health and well-being. So tonight, it is important why collaboration matters. I think about, when Jeff first mentioned a few moments ago about he was grateful to us for sticking around for so many years. Jeff remembers when we started this podcast. We started it during the pandemic. And at the time, it was just supposed to be an opportunity to share what limited information or knowledge we had about COVID-19. But Dr. Kane, in his infinite wisdom, thought it was important to, and I did too, actually, to keep the podcast going. 215 episodes ago, here we are, right? 5 years later, because there's so much to talk about. So with that, we didn't do it. We cannot ever do it alone. We collaborate with so many folks, primarily the Northeast Florida Medical Society, who helps or is our partner in this effort. But let's talk about collaboration and why it matters, Vicki. Mental health challenges are affecting communities across the country. From your perspective, what are some of the most pressing behavioral health issues? Now, I know you're not a therapist or anything, so let me just go ahead and put that disclaimer out there right away. So don't forgive me if I'm putting you on the spot, but just based on what you're hearing from your staff at the Partnership for Child Health and your knowledge in general.
Well, thank you, Jocelyn. And I would say that mental health is one of the most prevalent issues that we have in our community these days. Actually, it would be considered probably a public health issue. If you look at that, there is 20% of children that are either diagnosed or undiagnosed with mental health issues. So think about a classroom of 30, that is 6 children in there. And when you look at adverse childhood experiences, which is the foundation of trauma, and we have 50% of kids that are have at least one ACE indicator, you're talking about 15 in a classroom of 30. And then when we start thinking about the fact that the intersection of mental health and how that impacts children's behavior, and so you have children in schools that their behavior impacts their learning, their ability to sit still, the behavior issues that happen. These issues can lead them into the juvenile justice system. These issues become prevalent for children, especially those that are in foster care. And so I'm having a hard time with this thing here. The Partnership for Child Health is actually a child serving organization that's been around for a long time. I clearly am having some issues that's given me mental health issues right now.
We can hear you, so keep talking.
Okay. But if the Partnership for Child Health has been around for a long time. And one of the things that we do as an agency is we look at the gaps in services. And how can we then fill those gaps in services? How can we come across and bridge the issues and and bring resources to situations? So think about mental health, and we're looking at, well, we've got children who do not have access to care. That's a huge problem right now. Is if you've got 20% of the kids, and depending on where you live, and depending on what insurance you have, can be a critical component in whether or not your care gets addressed, whether or not your mental health issue gets addressed. And one of the things that we're seeing right now at the partnership is we're seeing younger children who are getting involved in situations at school, whether they are truant, whether they are making threats because they're 8 or 9 years old and they don't understand the ramifications of that, whether they have ADHD and they're just extremely impulsive and they can't sit still. And you have an entire educational system that doesn't have the resources to really provide for the support for some of these youth. If they're in classrooms where you've got 1 or 2 teachers, you may not have the resources to deal with Johnny, who is all over the place right now, and nobody understands why. And sometimes Johnny might get labeled a bad kid versus what's happened to Johnny. And that's where being trauma informed and understanding what causes youth and children to do some of the things they do.
Vicki,
Yeah, I heard on the
got a
news.
question. What are you, because you said, you're seeing younger and younger children. Historically, give me kind of a timeline transition as to why, as to what ages you were previously seeing and a transitional change to the current ages that you're seeing from a pediatric standpoint.
Well, I would say when I first started with the partnership back in 2010, the children that we serve were primarily 12, 13, 14. And we recently, back in 2019, with the state attorney's office and Kids Hope Alliance, we had the opportunity to redesign diversion, which is early offender programming for children who have been justice involved. So when that happened, at that time, we were probably seeing mostly 11 and, might be the youngest, 11, 12. But I can just tell you, just in the past year, we've had about 10 8-year-olds. We had 20 children under the age of 11. And I don't know if it's the tolerance at schools where they're not really understanding that an 8-year-old who makes a threat may not necessarily have the capacity to understand the ramifications for that, may not have the capacity to understand that the severity of that, and the zero tolerance of some school systems. And if you make a threat, depending on what that threat is, that you will have some sort of referral to the justice system. Now, we're very fortunate right now that the state attorney's office is extremely well versed in juvenile. I would say way more well versed than they've ever been in juvenile mental health and in developmental stages of youth. And so they're looking at that when they make their prosecution determinations. And so the majority of these youth are actually getting to be referred to diversion. And so, but we are seeing younger youth.
I really, one of the other things I wanted to ask just real quick, and Jeff may be able to chime in on this, even though he may have missed part of the conversation. What role do you think, or did the pandemic have in, going toward leading toward the younger ages with these mental health problems?
As far as the justice involved, you mean?
Or just in general with mental health?
Yeah, just in general. Yeah.
Well, I think the pandemic changed everything. We refer to pre-pandemic and post-pandemic, and it reframed society. It reframed our relationship to one another. I'm cleaning out my office, and I came across a book called Bowling Alone, which was popular a number of years ago, which reflected the lack of social cohesion and integration of individuals, both within their families, within communities, and the Surgeon General pre-Trump. So now it's pre-COVID, post-COVID. Now it's pre-Trump, post-Trump. Hopefully we'll get to a post-Trump, but about social capital, and so it was critical, and it continues to be critical. I don't know, we haven't started talking yet about social media and the impact of social media. We haven't spoken about boys in particular who are gamers and their addiction to video games and so on and so forth. So all of that reframed who we are as individuals, who we are as families, who we are as societies, and we're seeing the impact of it now.
Why is it important for organizations to work together rather than address behavioral health challenges alone?
Well, I would say one is that there's not enough resources. And I would also say that I don't know if one organization has all the expertise. If we look at what it takes to really have a true collaboration, you need the pediatricians. That's a completely different level of expertise than a behavioral health organization may have with therapy and case management. And the educational system, which is going to have another piece of the puzzle on this child. So you've got a child that, if you look at all the different domains that impact that child, you need different organizations that's going to come together with those pieces to be able to help that family.
But there's also cultural context as well. And I don't think we can ignore that cultural context. And so collaboration that brings in, multi-ethnic, multiracial organizations to address critical issues impacting their community is really, really important.
And obviously we have to, because we have to include the parents. So that's when, physicians like myself, who don't see a whole lot of pediatric patients, but with the parents being involved, the primary caregivers, and then sometimes those primary caregivers wind up being the population that I tend to see the most when they start getting into this geriatric zone because of, especially in our community, where you start seeing the grandparents play a significant and critical role in terms of raising those children.
Yeah,
Well, I
but
think
and
when
then
you
the
have-
other
ahead.
issue is that the parents are themselves dealing with
Yeah.
traumatic stress,
Mm-hmm.
depression, anxiety, and
Mhm.
so on. When I was with the health department, I remember, we had the state coming in all the time saying, with trainings for customer service and so on and so forth, and it'd say, well, we've got 800 employees in Jocelyn. Jocelyn can attest to this. 500 of them are coming to work with issues that are impacting them, and in dealing with mental health issues themselves. And so it's in particular depression, and as it relates to children, the parent, in particular a mother who's dealing with depression, is going to be able to adequately nurture a child is just not realistic. So unless we address parental depression, and the Academy of Pediatrics came out years and years ago stating that, in fact, part of the routine evaluation of children needs to include an assessment of the parent, and then referral of the parent to their primary care doctor, in particular family medicine physicians. And so we can't underestimate the prevalence of depression amongst parents, and also the issues that they're dealing with, which are overwhelming. And we have to remember that 50% or so of families are existing in the context of poverty. And so just the daily routine of trying to stay solvent, so to speak, and nurture their kids is in some ways a challenge in and of itself.
I remember
then
years
when you
ago.
couple, I was going to say,
Right.
when you couple the social determinants of health there, which is part of what Jeff was talking about, and you start adding just basic Maslow's hierarchy, you've got families. So not only do you have mental health issues, but if families are struggling to stay solvent, to feed their families, to make sure they have a place to live, to make sure that they, their children have a safe place to be, then mental health kind of falls to the bottom of that priority list with families when they're just struggling to survive. And then, of course, when you look at where, the health department, again, back in 2013 came out with that, the research on place matters, that depending on where you live in Jacksonville, you may have to take a bus or two to get to fresh food. And you may have to take a bus or two to get to access to care, or to be able to pick your child up just to take them to the doctor.
And I see that
The
possibly.
one statistic that, go ahead.
I was just going to say, I see that possibly getting worse in the very near future with the ongoing political and situations that we have going on. And we already have enough problems trying to provide with the limited resources that you guys have and the medical community have. It is, I just, as much as I hate to say it or see it, I just see within the immediate future, we're going to have a really tough time dealing with the social determinants of health. that will be affected so much with the ongoing situation we have over in the Middle East and around the world, actually.
Yeah, I
Well,
don't
and
know
that's
if the
where,
statistics are still the same. Vicky, you may know, but as far as funding of mental health services, Florida for years was
still
last,
ranks one of the
or
lowest, yes.
yeah, last or second to last
Mhm.
among states. And a statistic that has always um, has always amazed me, which is seldom reflected in dialogue and discussion, is the number of children who will switch schools in a year. It's
Mm,
upwards of 30 to 40% of children will finish
mm.
a school different from the school that they started
That's
at the beginning
right.
of the year. And so if we look at that and the importance of social capital, the importance of permanence of relationships between young children, school-age children in particular, that variable is really serious. And if you compare that to the stability that we experienced when we were in school back in the 1700s, it's a big difference, and it
So
makes
our
a huge
audience,
difference.
yeah, so our audience includes a wide variety of people. There may be some physicians listening, or folks just who are retirees, or just a variety of people. What role would you say that community-based organizations and trusted community leaders play in improving mental health outcomes?
Well, I would say if you look at places like churches, or recently, Jocelyn, we've done work with barbershops,
Mhm,
is it normalizes the conversation when these are places where people go on a regular basis.
mhm,
This is where they have their relationships, their connections. And when
mhm,
they have folks there who are trained, like one of the things the partnership has done is we've tried to train individuals within faith-based organizations. And we had 32209 experience that we funded to go work with the barbershops and training individuals in the barbershops. So when people are coming and just having regular conversation,
mhm.
they're able to get information regarding mental health. It normalizes the conversation. It can provide places where individuals can go that they would trust and that they would have recommendations from. But I think that's the big thing, is it reduces the stigma as well.
Well,
Yeah, and we're social creatures.
yeah.
From an evolutionary
Mhm,
standpoint, we
mhm,
are we're social creatures. And when you eliminate the social nature of what it takes to survive and thrive, and then you eliminate a really critical part of who we are and what we need as humans. And community-based organizations
mhm.
are the only entities that can provide, in some respects, that social capital, that social environment, that community environment. That as I say, we use it too much, but it couldn't be more true that it takes a village
That's
to
right.
raise a child. And I think you all would agree with the statement that the issue of mental health is the critical issue that we're struggling with in society today, um, and we're not succeeding.
You
Um,
know, with the I know we were talking about collaboration. And one of the things that we know with the resources being so, I think everybody is struggling to find enough resources. And if one organization could do it alone, they would do it alone. And with being able to have um, a collaboration of organizations, which really provides an opportunity to pool resources together. So if we provide care coordination, like currently right now, we provide care coordination for pediatric practices. And so pediatric practices that do not have the opportunity to, or the funding or the expertise to have in-house care coordination, but they do see they see juveniles who, and if you think about 1 in 5 having a mental health issue, then there's a lot of juveniles coming through their door that's not being diagnosed or are being diagnosed. And maybe they'll make a referral, but we know that some of our families do better off when they are having their care coordinated and they're being walked through and they're being supported. And so the ideal for us to be able to provide the support to pediatric practices to be able to coordinate that care. It provides not only, it has the hub where the pediatrician is able to have an all-encompassing view of their physical and their mental health, but then being able to have somebody else with the expertise to be able to get this family to more of the services that they need and get that information back to the pediatrician.
Another thing I like, Vicki, is when we had the opportunity to train a lot of those, what we call trusted messengers from the community, in terms of the community health worker training, because those are people who their neighbors know them, they're in communities. And so by arming them with more information about how to respond to folks, how to recognize when someone is experiencing some level of trauma. I heard the other day that there was someone who, and it happens in every community, who committed suicide. When you hear that, it's just, it just does something to you, right? So anyway, if you're just tuning in, we're talking about answering the questions of how community partnerships improve mental health and well-being. And our guests this evening are Dr. Vicki Wadowich and Dr. Jeff Goldhagen, two folks who've been doing the work in the community in various capacities. So let's back up a second, because one of the things I want us to talk about as we talk about collaboratives. So for those folks who may not be familiar with the concept, what is a behavioral health collaborative and how does it work?
Well, I can tell you back in 2010, when I first met Jeff, he had put together one of the first behavioral health collaboratives that had multidisciplines. Jeff, do you want to talk about that? Because that was one of the first ones that I had been to. And
well, this whole focus on mental health is an evolution, a work in progress. And we started off, 15, 20 years ago, really from a point of departure. We hadn't had the collaboration. We hadn't had a public health approach to addressing these issues. And we brought the community together, and we wrote a grant to the federal government, SAMHSA, and it was rejected. And we wrote it again. It was rejected a second time, and then we wrote it again, and finally it was succeeded, which allowed us as a community, in part in collaboration with the Partnership for Child Health and the Health Department, to really move forward along this continuum. And it's, again, it's too well worn, but the idea that it takes a village to raise a child, it takes an interdisciplinary group of committed individuals, which includes the community members, in order to be able to accomplish what we need to accomplish. And in that collaboration, Jocelyn and Vicki, you can comment on training individuals from the community to diagnose and refer. That what's that program called?
collaborative care.
No. When we train individuals to recognize mental health issues.
Oh, mental health first aid.
Yeah, mental health first aid. So in the same way we teach individuals how to do cardiac resuscitation, we've had a large swath of our community trained in mental health first aid by a number of organizations, including the Partnership for Child Health.
Right.
So that it's not just organizations, it is each of us as part of a collaborative, so to speak, to identify and help people refer themselves or refer them to mental health providers. And the first step, frankly, is to their physicians, family medicine docs for the older folks, and then pediatricians for younger people. And then I think one of the things that we've been really successful with is years ago, again, with some funding from the Hall Halliburton Foundation, we worked with a young child psychiatrist who we engaged to train pediatricians and some family docs to actually diagnose and treat individual children that were coming into their practices because we didn't have the resources to refer them to. And we trained well over 200 professionals in the community to diagnose common mental health issues, suicidality, depression, anxiety, to diagnose them, to treat them, and then gave them the opportunity to refer to a child psychiatrist for those kids that they were not able to care for. It was tremendously successful, and in fact, that model has been duplicated across the state. So that, in a sense, was our collaborative care model.
Can I just jump back a little bit on when you were asking about a collaborative? One of the things that that this collaborative that Jeff put together back in 2000, and well, since it took 3 times to get the grant, it had to be 2007. But one of the things that, if you look at the whole domain of the child, there were pediatricians, there were early learning providers, there were the schools, you had the justice system, you had mental health therapists, you had the whole gamut of who deals with a child and in what capacity, because we didn't think at the time about bringing so many different disciplines in. We had foster care, and so when you think about all of those components and how they can all really work together, it's a lot of work when you're pulling everyone together, but it works so well when you don't have the funding, and it works better for the child whenever you can work with, you can address the housing issue, or you can address the mental health, you can address the school issue. So the other day I was in we had just started a specialty court, and we were in the courtroom, and there was a child who was 14 in the 6th grade. Well, guess what? We can address his mental health all we want, but he really needs to also be in an appropriate educational setting, because he had some struggles with some peers there. Well, so while one agency may be focused on mental health, somebody else needed to be focused on getting him in the right educational component. Somebody else needed to be able to deal with any kind of family situations that were going on. Maybe mom needed a job. Maybe so there's lots of different, like Jeff said before, we've got families who need to have their own issues addressed and need to have the social determinants of health that are detrimentally impacting that family from progressing and that child from progressing. They have to be addressed as well.
Yeah,
and we don't live in extended families anymore. So
right.
When we lived in extended families, and I grew up with an extended family for the first 6-7 years and I remember what it was like, and it's really critically important. They played an important role. It doesn't exist.
Yeah, we were talking earlier how, when we were growing up, the only persons whose houses we could spend a night over were our grandparents or relatives, basically. We didn't get the luxury of staying here, there, the other place, because our parents wanted to know exactly who we were around, who we were with. When you talk about the social determinants of health, I remember during the time of COVID, no matter what we came to talk to people about related to COVID-19, if they didn't know where their next meal was coming from, if they didn't know if they were going to be evicted, if, the basic things that people need in order to survive. So I'm glad you both have brought up the social determinants of health, because it is so critical for people to know that we can't always push our agenda. We need to first have a conversation with folks and ask the question, how are you doing today? Right? Because sometimes you will learn so much about people by simply asking that question. How can communities become, Vicki, more trauma informed, particularly for youth and families experiencing stress or adversity?
So I like that you asked that question, Jocelyn. We, as you know, we have been fortunate to receive some federal funding to address that specifically. And one of the things that we focused on with the partnership, as are a lot of other community providers as well, is how do we ensure that the providers that work with our kids are trauma informed? What does that look like? One of the things we've contracted a lot with Hope and Healing Jacks that does trust-based relational intervention, which really provides strategies on how do we work with children who have been exposed to trauma. But on top of that, how do we know? And sometimes it's a matter of treating all children with trauma-informed care, not just a special way to treat one child. If you think about children that come to school every day, you can just imagine that for a lot of these kids, if not all of them, they probably are carrying not only that backpack on them, but an invisible backpack as well. And we don't know what's in that invisible backpack. This morning, my child got up with a really bad headache. And so I did what every other good parent does. I sent him to school with Tylenol. And okay, kind of joking there, Dr. Kane. Don't look at me like that. But I did send him to school. He was fine. He wanted to go to comic club. But I did had to let his teacher know that, what? I don't know how that's going to impact him. He says he has a headache. I don't know how that's going to impact him. But that was just a simple issue. If you're a child that is going to bed that's going to bed hungry, or you're going to bed and you've had parents fighting all night, or maybe you've had a tragedy that occurred in your family because a grandparent passed away. And a lot of times this information won't come to the teachers. They won't know. But you may see Johnny acting differently.
Go ahead, I'm sorry.
Well, he may come in and he may put his head on the desk, and you may just imagine that he is being lazy. He just doesn't want to do his homework, or, oh, you stayed up late playing video games, when really that's the furthest from the truth. Yeah. And so the assumption needs to be that something's happened, what's happened to you, and not what's wrong with you. And honestly, one of the strategies that comes out all the time is give the child something to drink. Maybe giving him a glass of water will change an affect. Maybe giving him a piece of candy will change an affect. But there are strategies that we want to train not only teachers, but we want to train parents. We want to train professionals, anybody that works with children. We want them to know that that there are strategies that you will want to use that could mitigate a child's behavior, whether it's, good, bad, or ugly. But you can address the child's behavior by first starting off with what happened.
Yeah, Vicki says something really, I think, as she always does or routinely does, so profound. And that is treating all children with trauma from a trauma-informed perspective. One of there's two comments on that. One of the years and years ago, I can't remember where I first heard it, but the statement programs for poor people are poor programs. And it's also really important to understand that the ACEs, the adverse childhood experiences, which we rely on to diagnose to a great extent or certain extent, social determinants of health, those ACEs were generated in middle and high income communities
Mm.
who were, and I think that's really important because it reflects the fact that at the beginning of our understanding of the social determinants of health, at least as it's been formally integrated into, into our systems, was focused on middle and upper income communities. So it's not low income communities it's not ethnically at certain ethnic communities, whatever. It's all children. And we need to really create an environment that respects the realities that all children are dealing with. But we tend to target different communities, and really that's a huge mistake.
So you talked about funding. Funding will always be an issue, but what are some other barriers or challenges when building and sustaining a behavioral health collaborative?
Well, I think there's always, you always want to build trust in the communities. One of the things that we've seen over the years, we've heard about it many, many times from community members, is that people come in, they start a program, and then they leave. Or they come in and they tell the community what they need,
Mm-hmm.
versus, like Jeff said, really going in and being part of the community, but having the community tell you what you need, what they need. I think we're seeing that a little bit. We're seeing it a lot more now with the CBA, the community-based benefits agreement, where the community is coming out and the community is starting to tell the city what they need in their community. And funding is challenging, and I think there's, one of the challenges that we have is thinking that nonprofit sector is a handout. I think the stigma or that mantra that's gotten out there by whoever couldn't be further from the truth. It is the safety net, and the community is only as strong as its safety net. Because when we see people fall through the cracks, it's not because people fail; it's because plans fail, and programs or the community itself hasn't provided the safety net that it needs. And, we're always looking for funding opportunities, but we're also always, and this is, the discussion we're having about collaboration. Nonprofits have to collaborate. There isn't enough money out there.
Mm-hmm.
And so when people say, oh, you're working in a silo, you need to collaborate. Nonprofits in the past 10 years have done more with collaboration because they have to come together. And that doesn't necessarily mean sharing funds so much as it means sharing the expertise and making the appropriate referrals to the organization that has the funding. So if I have a family that is homeless or in need of housing, I'm going to refer that family over to Salzbacher. I'm not going to try and furnish a house for them because we don't have those types of resources. But we have partners in the community that do have those resources.
Yeah, that's a good point. Dr. King, were you going to say something?
I was going to ask, I know we were concerned, within the communities and looking at the communities as a whole, but with some specifics, maybe if you guys can tell me, how do we begin to identify those kids that are facing some of these issues, especially those that the issue may be coming from the school system itself, whether it's a teacher or whatever, and or from the home itself, it's a parental problem. What is the common person listening to this audience and or the professionals? What do we need to, how do we start looking at it?
I'll jump in first and let Jeff take over, but I would say the first line of defense there is your primary care physician, is your pediatrician. One of the things that Jeff was alluding to with the some of the funding we had and what we've done historically is to train pediatricians. We have a deficit of psychiatric help. We have a deficit of therapists. So we really In some cases, there's wait lists, but the primary care physician can be the first line in assessing a child and trying to identify help for that child. And that's, I mean, that to me is always the first way to go. And then, of course, with the school system, we're very fortunate right now to have a focus on therapists in the school system. So all of our Duval County Public Schools has access to therapists. Now, some of them have a one-on-one with one therapist per school. Some of them are one therapist for two schools. But that is something that if parents have a concern, they should immediately reach out to personally this. And I don't know what Jeff will say about this, but I would say reach out to your primary care physician if you have a concern about your child.
Yeah, so in public health, we talk about primary, secondary, and tertiary care, with primary care really being preventive, and then secondary treatment and tertiary rehabilitation. Once we get to treatment, we're pretty much, we haven't lost the whole game, but we're behind. So my sense is that we really need to start off in our early child development, early child education system. We have a wonderful early learning collaborative here, and really take a focus on the first 6 to 7 years of life. That's when brain development is at its peak. And what I tell, when I work with residents, I say, when that 4-month-old is sitting on the mother's lap in front of you, what do you see? And they'll go through lots of descriptions and so on, and say, I just see a brain. And all the other systems are pretty much developed by then, and the only thing that's really developing is the brain. And so we have that first 7 years to really focus on nurturing that child, nurturing the parents, nurturing, creating a system that will really focus on optimal development of the brain. And so I think we take a systems approach and start off, and to a great extent, start off in utero and bring the systems together to really nurture that child. And we're all stakeholders in the health and well-being of that individual child. From a child rights perspective, which much of the work of the partnership is really grounded in child rights, there's a critical principle called that focuses on the interdependence of rights. So you might be able to fulfill a child's rights to health, but unless you fulfill the other 40 individual rights that are listed in the Convention of the Rights of the Child, you've failed. So we can't just focus on one part. As Vicki was saying, we focus on health, we can focus on identity, we can focus on education. We have to look at the whole child and have a whole child holistic approach. Otherwise, if we segment individual parts, we lose immediately. So again, it's bringing the community together from a systems perspective. And let me just take a step back. And we all to a certain extent walk around with chips on our shoulder. Jacksonville, Duval County, this community does a phenomenal job in coming together, collaborating, working together. Coming from up north originally, I was amazed when I first moved to Jacksonville at how collaborative and committed individual organizations were to working together. So we do a great job here in comparison to other communities around the state and around the country. So we should Congratulations.
I'm going to jump in just before they move on to something else. If you have because as much as I say, if you have a child that has an issue, if you have a child that you're concerned about and you're not finding the help you need, you can reach out to the Partnership for Child Health. We have a care coordination and a integrated behavioral health component there. And if there is anyone that cannot, that is having challenges with the services that they need, they can absolutely reach out to the partnership.
And we'll put the partnershipforchildhealth.org on our website. So, Vicki, you talked earlier about mental health first aid, but how can community members become more involved in improving mental health in their neighborhoods?
Hey, I talked originally about mental
Oh,
health.
pardon.
And you go ahead and answer this question.
Don't be giving Vicki the.
Then you just go ahead. You go ahead and answer her
Vicky
question.
has the
I
hair.
just didn't know what it
So-
was called.
You go ahead and answer this question then.
No, I will defer to my esteemed partner in crime.
So, I would say one of the efforts that the hospitals had a while back was trying to get every community member trained in mental health first aid.
Mhm.
And if you think about, wanting everybody to be trained in CPR because you want to be able to save a life.
Mhm.
Well, if you think about mental health first aid being able to save a life, then it takes on a new meaning. And when we talk about suicide, I think has jumped up to the second leading cause of death for 10 to 24-year-olds. And that is, that's incredibly significant. And so to think about being able to identify certain warning signs, how to talk to somebody, anybody can get online and find mental health first aid. Talkable Communities is actually a collaborative between 5 of the organizations here that do free mental health first aid training, and that is talkablecommunities.org. And there's a lot of organizations that do the training. Partnership also does the training, but if you go onto the Kids Hope Alliance website, they have TBRI training for free. And that's understanding trauma, and that's understanding how to be able to talk with children and strategies to intervene, which is what mental health first aid does as well, is provide strategies and language on how do you talk to somebody that you might think is having a mental health issue or somebody who's depressed.
Yeah, and you mentioned earlier, Vicki, the work we've been doing with barbershops, and the feedback we've gotten from barbers has been profound. I happened to witness a conversation they were having, and they were very forthcoming talking about the experiences that they had growing up. And so now being exposed to TBRI from the community perspective, they realize, as most people realize who we've trained in trauma, that their experiences had a name, is what I always say. That is trauma. It was a way of life, is all people saw it as. But what some of those men said is they weren't necessarily fond of how they were disciplined, for example, and nor were they fond of how they did as a man in relationships, right? And so now being exposed to these new concepts, they're seeing that, hey, wait a minute, maybe there is a different way of doing something. And the way I interact with my children, with my mate, my wife, with my parent, whatever the case may be. And so being exposed to this formalized training, they're now saying, I can change the direction of how my children react and how they're treated in the future by understanding and learning about what the trauma, how my trauma has affected me. What are some promising strategies as we, wrap up tonight's discussion? Yes, it's almost nearing the end, but what are some promising strategies or programs that communities can adopt to promote resilience and healing?
Well, I would say that trauma-informed training is one of the first. mental health first aid. But there's a lot of evidence-based practices out there that have to do with making sure that that your programs are culturally competent, making sure that we're not inflicting any more harm onto a community. We have a lot of evidence-based therapies in the community, like functional family therapy, cognitive behavioral therapy. We've got trauma-focused cognitive behavioral therapy. And with what we've recently implemented in the past 4 years has been a SAMHSA promising practice of play, preventing long-term anger and aggression in youth. And that's really meant for communities that have, or for youth that have been exposed to violence, that need strategies and coping mechanisms for dealing with conflict. And how do you mitigate your emotions, or stabilize your emotions, or regulate your emotions, so that you're not coming out and making or escalating a verbal interaction into a physical, into a lethal interaction.
Mm-hmm. Yeah, yeah. And we've gotten some positive feedback from some young people who've participated in play. You know, they've actually de-escalated some situations amongst their peers. Like, hey, wait a minute. I just went through a play series and they said such and such and such. So it's really been phenomenal how we've had young people to share what they've learned from the different workshops and things that we've exposed them to, and the activities. And one of the things my colleague always says, that if you are a faith-based organization, or if you are a small nonprofit, there is something extra that you can do. You know, summer is about to happen. Everyone cannot afford to pay summer camp, for example. We know in most cities, they offer some type of assistance or some summer programs. But if you have adults in your church or in your civic group, then all you have to do is plan maybe once a month an activity, bring some young people out. You know, kids love hamburgers and hot dogs. I know, Jeff, those are not the healthiest options, but and Dr. Greg and Kane, but kids love it. They don't take a lot, right? All they want is some of safe environment. In Jacksonville, we've had these teen takeovers. You know, if more adults would help to organize some of these activities, then that may kind of maybe discourage these young people from getting involved in activities that get out of control. So just think about it, you know. And again, if you're not sure what to do, reach out to us. And yes, I say us because I do work at the Partnership for Child Health. And so we are doing some wonderful things, because I don't want to see your little niece or nephew show up in one of our programs where they have gone through the juvenile justice system and land with one of our case managers because they did something they shouldn't have been involved in. So there is an opportunity to do some things beforehand rather than on the back end. Were you going to say something, Vicki?
Yes, you made a comment about what can people do in the community. Youth need connections. They need positive connections. And we've always said that, you know, you can have the best of programs, but if youth are not feeling a connection with the people that they're working with, you are not going to see the change. And youth are one connection away from that isolation and that alienation. And really, if everyone would find a youth to build a connection with.
Yeah, the term is social capital. It's really building social capital, starting from the family and then expanding out into the community and schools and so on and so forth. It's really exceptionally important. And then recognize the challenges that young people are dealing with social media, and all of the trauma that they're experiencing, whether you're rich or poor, whether you're white or black, whether you're Christian or Hindu or Muslim or Jewish, whatever, it's ubiquitous.
Yeah, we didn't even get into social media and the video gaming and all those things that sometimes, you know, Tyrone, our behind the scenes guy, he was like, wait a minute, don't blame it on technology, but it's all about managing it. And one of the folks that have been involved in the work with us, Mark McGuire, commented, play preventing long-term anger and aggression with youth. It's a series of sessions that we do with young people. Again, it's amazing. It's introducing some concepts that young people never thought about. So we're at the end of the show. We are so appreciative of both of you joining us this evening. At the end of every show, we like to give our guests an opportunity to share their final thoughts. And Jeff, I'm going to start with you this time. How about that? Since I started with Vicki at the beginning, can you share any final thought that you'd like to give to our audience tonight before we close the show?
Yeah, I think it begins with respect and honoring the dignity of young people, beginning at birth and then continuing thereafter. Again, we take a really child rights-based perspective. It's really fulfilling the rights of children to optimal survival and development, to health, and that begins with respect and dignity.
Thank you so much. And they are people. They are little people, but they are people. Vicki, what are your final thoughts?
I would say, we started off talking about mental health and well-being, that behavioral health challenges, mental health challenges are complex. They're very complex, and they require sometimes complex solutions, and which is why we need more than one, sometimes, organization to deal with things. We need more than one person. We need more than one discipline. But I do believe that with complex complex challenges can be solved with a multi-disciplinary approach. And I think that's what we try and do, not only at the partnership, but with behavioral health collaboratives, is we try to bring complex, solutions to complex problems. And if you have a child that you feel is needing additional services, or you're worried about them, don't wait. Reach out to us, reach out to your primary care physician.
Thank you so much, Vicki. And Dr. Kane, what are your final thoughts?
Well, I want to thank Dr. Wadewitch and Dr. Goldhagen for coming on to the program. Learned so much this evening. Of course, I go back and reiterate that I'm not doing much in forms of pediatrics, but I do deal with those individuals that take care of those pediatric patients. And so I think, as a primary care physician, even though I'm family practice and don't focus as much on pediatrics, I still think that we need, in terms of the physician community or the health providers community, we need additional training in terms of recognition, awareness of programs that are out there, as to how we can help with these collaborative efforts. And if there's any ideas that you guys have in terms of obtaining grants and stuff of that nature that can help assist us in achieving that goal, I think that we should look at trying to move forward on that idea.
Thank you, Dr. Kane. As we wrap up today's conversation, one message stands out very clearly. Improving mental health is truly a shared responsibility. Behavioral health challenges don't exist in isolation. They're influenced by where people live, learn, work, and worship. That's why strong partnerships between healthcare providers, community organizations, schools, faith institutions, and residents are so important. Tonight's discussion reminded us that no single organization can meet every need, but when we work together, we can create systems of care that are more responsive, more accessible, and more supportive for the people who need them most. We want to thank our guests from the Partnership for Child Health for joining us tonight, and for the important work you're doing every day to strengthen community partnerships and improve the well-being of children, families, and communities. Your leadership demonstrates what is possible when organizations come together with a shared vision to support healing, resilience, and hope. For our listeners, we encourage you to remember that mental health matters and that each of us has a role to play. whether it's supporting a neighbor, reducing stigma, advocating for resources, or partnering with organizations working to improve community health. Thank you for tuning in to Pause for the Truth. You can watch or listen to this episode again and share it with others at www.pauseforthetruth.com. And don't forget to join us next Tuesday evening at 6:30 p.m. for another important conversation. Until next time, take care of yourselves and one another. Good night.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.